Have you ever heard of a gluten-free diet? No? Then today is your lucky day. This video revolves around the idea of gluten-free diet and how it came to be. Gluten-free diets have surprisingly become so popular, and it's kind of easy to get the most popular foods gluten-free. But what is this all about? Gluten is a major culprit to a specific disease that I'll be talking about today. But before we get into that, here is me as Dr. Naik confronting a concerned patient, Mr. Wynn. Good afternoon. How was your day?
Good.
Okay, so what are you in here for?
I've been experiencing abdominal pain,
Okay, what else have you been experiencing?
bloating, diarrhea, gas.
After listening to Mr. Wynn's symptoms, I went back and researched some possible conditions, and I came up with a couple diseases that could pertain to his symptoms, like abdominal pain, bloating, diarrhea, and gas. But these symptoms are still so vague, so I came back and asked him more questions like family medical history. So I may have found the possible reason to why you're having these symptoms. So can you tell me more about your family history, medical history?
My grandma, my mom in the past had celiac disease.
Oh, celiac disease?
Yeah.
I may have found your reason why you're feeling the way you are.
What?
And that is celiac disease. Diseases like celiac disease have no real cause, but it can be passed on genetically, as in Mr. Wynn's case. Celiac disease is known to have symptoms that Mr. Wynn is having, but it also includes symptoms of severe skin rash, iron deficiency anemia, muscle cramps, bone joint pain, failure to thrive or grow in children, seizures, and other symptoms. But it can vary from person to person. Celiac disease is an autoimmune disease in which your immune system attacks itself. So it'll attack your organs if it detects any foreign substance in your body. So for instance, if you have gluten in your body, your immune system will try to attack it. So have you eaten any gluten lately?
Yeah, last Thanksgiving.
Okay, so what did you exactly eat?
I ate greens, potatoes, tomatoes, lamb, and hamburger.
So what is celiac disease? It is often referred to as gluten-sensitive enteropathy or celiac sprue. This disease is an autoimmune disease that affects 1 in every 100 people. It is autoimmune because the body's immune system attacks healthy cells, which in this case happens in the small intestine. This skit showed how the immune system reacts to gliadin, which is an important molecule in gluten. The immune system forms antibodies to the gliadin, which then attacks the intestinal lining. This constant war zone initiates inflammation and damages the intestinal villi where food and nutrient absorption takes place. So here is pictures of how a healthy small intestine looks like compared to a small intestine of someone with celiac disease.
So how can you test if I have celiac disease or not?
Well, we already discussed your medical history in your family, so now I'll take a blood test to see how many different antibodies you have in your blood. I'll also test the nutritional deficiencies that you have in your body and also do a biopsy to where I can see if your small intestine is healthy or not.
Okay.
Okay, so after doing all your tests, it looks like you're positive for celiac disease.
So since I have celiac disease, how do I combat it?
The only way you can combat it is by having a gluten-free diet. So you need a strict gluten-free diet. If you have any gluten in your system, it will trigger the disease. So you need to make sure to stay alive. Okay, so make gluten-free diet, right?
Yeah.
Okay, you'll be all right, buddy.
Thanks, doctor.
You're welcome.